any couple suffering from the problem of infertility which come to our OPD, in such patients, there are a few investigations in the female which have to be done to see 3 to 4 things are there. First of all, we have to see the condition of the uterus. What is the size of the uterus? What is the condition of the endometrium, the thickness of the endometrium, because endometrium or the uterus is the place where the baby is going to grow for 9 months. So this can be done on a simple ultrasound. A transvaginal ultrasound is always preferred over the abdominal ultrasound, and from an ultrasound we can get this simple information regarding the condition of the uterus. Second most important thing is the fallopian tube. For a normal conception, the 2 fallopian tubes, they should be open and they should be healthy also. So there are 2 tests to check the patency of the tube. First is an HSG, which is a hysterosalpingography. It is a simple X-ray. And with the means of an X-ray, we inject a dye from below into the uterus, and we see with the help of an X-ray whether the dye is going out from the tubes or not. So it can be visualized on an X-ray, simple X-ray, and we can get this information regarding the patency of the tube. Nowadays, we prefer doing a sonosalpingography. It is simpler and less painful than an HSG, and it can be done in any OPD with an ultrasound guided. We can see whether the tubes are patent or not. Third thing which has to be investigated is the condition of the ovaries, the size of the ovaries, whether the size is normal or it's small or it's a big polycystic ovary. That can be seen on a simple ultrasound, transvaginal ultrasound. And simultaneously, we get few hormone tests done. That is to see the ovarian reserve. The test is the anti-Mullerian hormone, which is a simple blood test. We can do an FSH, LH, thyroid profile, and the prolactin hormone as well. So these hormones are very important in the fertility in any woman. So they have to be done before started treating any patient. We have to do these investigations. So basically, broadly, these are the few tests by which we can get the information regarding the uterus, the tube, the ovaries. And then in few cases, there are cases of unexplained infertility where all these investigations are normal, but still we are not able to come to any conclusion that why the patient is not conceiving. So in those cases, then we can proceed with a laparoscopy and a hysteroscopy to confirm our diagnosis, because there are few things like endometriosis or the tube is not healthy, which cannot be diagnosed with a simple ultrasound or an HSG. So by the means of a laparohysteroscopy, we are able to reach to a conclusion as to why the female is not getting pregnant.